Call it Park Bubba Sparks.
Booty, 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 rockin' everywhere. Booty, booty.
Hey, I don't know what to do.
What's up, YouTube? It's Desi and I'm back with another video, you guys. And with this video, I'm going to talk about what is it like being a day of being a pain management medical assistant and pretty much what to expect. Also, this video is going to tell you guys what was my lowest paycheck as far as for medical assistant. So let's get right into it. So basically, as you guys can see, I'm gonna go ahead and post a picture as far as for showing you guys my lowest paycheck as a medical assistant, and you guys will see that coming in. And as you guys can see, yes, I was only able to take home $600 as far as for a medical assistant, and that is here in Florida. So basically, when I first started off with pain management, with it being a private clinic, basically it's almost like the doctor has his own rules. So basically, as you guys can see, I was only getting paid $14 an hour. Now that was at the start time. Now basically before I had left the job, I still had like a $2 raise as far as for them, but it wasn't as much. So basically overall $16 an hour I was getting paid, but I still felt like I can kind of do a little bit more. Now with pain management, I would say if you're looking to go into pain management, it's definitely good. It's a great experience. I definitely had great experience as far as for pain management. The only thing is it has a lot of cons that come with it. So now the pay, that was my lowest paycheck. Now as far as for when COVID hit, it did kind of decrease a little bit because we were having patients as far as for just telemedicine, where it's like we would talk to them virtual versus them coming in the office. The only people that was coming into the office was the new patients. But however, I definitely feel like pain management was one of the jobs I had got my experience with a lot of procedures. But however, I definitely feel like it has a downfall. This right here was able to pretty much show you guys my duties that I had to do as a pain management medical assistant. So when I first got hired, don't mind this, you guys, this is going to be the title for the video. When I first got hired, the doctor gave me this, and this was pretty much telling me all the duties that I would do. So the front desk will have this, and also the back office will have this. So as you guys can pretty much see on here, my duties would range from, so up here they have on here where I had to answer the phone calls throughout the day, also review documents and telephone encounters. That's basically where e-clinicals come in at as far as for that part. Also patient care. So on here for patient care, it says once patients checked in, see patient, please verify medications, please verify changes in past medical histories, family histories, social histories, update the system, take vital signs and document, close chart with symbol. So we will always make sure that we symbol every time, like, you know, that's how me and the doctor would communicate back there, where basically in the back end, as soon as I'm done doing everything, I will have to click vitals taken, and it'll show like a stethoscope, and then that'll let him know that he's good to go ahead and go in there to see the patient. Once he's done seeing the patient, it'll be a check mark, so that way we know they're done and they're good for checkout. But basically, as you guys can see, this part right here where it talks about verify medications, family history, social history, this is pretty much what I do right now as far as for remote medical assistant. Except everything is, I'm taking that information and generating it into making a progress note, so that way that goes back to the doctor, and that way if anything is needed as far as for a prior authorization for medication or injection, that progress note is what's going to be used to help it get approved. But that's a whole nother story. Other duties that you'll do as a pain management medical assistant is that you'll be doing a lot of UDT testing. So urine drug testing is basically what UDT means. Basically, you'll check to make sure that the patient is taking the medication positive as far as for what the doctor is giving to them. If they are negative, that's when the doctor, if he would like to, he can send it on out to get it tested to Millennium or Quest. You'll also then need to make sure that you follow up with the urine report. So that's where you'll then go ahead and load up on Millennium or Quest to pretty much get that report, and then that can kind of help you out as well too. Samples will get picked up around like 4:30 or so. Sometimes it's earlier, but it all depends on how the delivery station is working at your job or whatnot. But I definitely feel like pain management is something you can kind of get your experience with as far as for urine. Most people are kind of scared of urine and whatnot. Me personally, I don't really care, because medical assistant, we deal with a lot of specimens, we deal with blood, so that shouldn't really bother you. But most people, if you're kind of scared of that, just probably stick to the front desk. I mean, some people, they're not the same, so I understand. Also, if there was ever a billing issue, so say for instance some patients call in and say, hey, I got a bill from Quest Millennium due to my urine, they gave me a $500 bill, I'm trying to see what's going on, always transfer that to the billing department. You don't want to get yourself into something you can't get yourself out of, so don't try to handle that in your own hands. Also, medications authorization. So that's something that I will always do. What we'll do is we'll go and cover my meds. Cover my meds is basically where you go and you kind of do the authorization for the medication. So they're going to ask for the insurance name, the patient name. They're going to ask for the patient insurance ID number, and then that'll go ahead and generate the form that you need to be used. Once you get that, they're going to ask you for the quantity, the directions for the medication, the type of medication. They're also going to ask for, as far as for why is the medication needed. So they're going to prompt you different questions. Now what I would do is I would already kind of have like the notepad that's kind of on the computer, and I already have it like for each patient that I would do a prior authorization for pretty often, so that way I'm not trying to remember what did I put for this question. Because if you mess up one question will cover my meds, they will deny it, and then you have to get on the phone with the 1-800 number and stay on the phone with them all day. Florida Blue is so aggravating, and Better is so aggravating, so I try to make sure I keep up with everything. Now, and Better is a type of insurance where you will have to I'm sorry I sound like this, y'all. I have like allergies like crazy. And Better is what you have to use as far as for every 28 to 30 days. So you'll be doing a prior authorization for that patient every 28 to 30 days. Like even if you miss one, they're going to be behind on their medication. So what I would try to do is keep a whole entire chart, and that lets me know as far as for when that patient needs to get their medication renewed. Trust me, they will only approve it for 30 days. You'll be lucky if they approve it longer than that, but lately, due to the COVID and stuff like that, what's been going on, they only approved it for 30 days. But medication authorization is very important.